So with this, I will now ask our next speaker, Dr. Amanda Wheeler. Oh, she's there. Amanda represents actually two organizations. She's affiliated with CSIRO, and we've actually worked with Amanda and with CSIRO on several different projects. There's a very important paper which was submitted last week or 2 weeks ago, but that's a separate issue. But Amanda also wears a hat of the Center for Safe Air. And I'm very pleased that the center and the director of the center, Professor Faye Johnson, agreed to be partner with us on this activity of the report. So the report so far has only Thrive logo, but the idea is that with the support of other organizations, we hope to have other logos, and this Center of Safe Air logo will be there. Amanda will be talking about, both indoor and outdoor air smoke from bushfires, which affects indoor air and wood heaters. Amanda, please. Sorry.
It's a problem.
Thank you. Thank you very much for the invitation to attend today. As Lydia had mentioned, I'm presenting on behalf of Professor Faye Johnston, and I think the opportunities going forward in this space, I think, are very helpful for both centres. So for the Centre for Safe Air, there are sort of three specific work areas, and I think that today I'll focus more on the buildings for safer air, which is a community of practice that has been pulled together, and bringing a number of different researchers and policymakers together on a fairly regular basis. And the idea is to be able to translate evidence into policy and practice and provide some training for emerging researchers, and we develop novel research data sets and make sure that we're collaborating with all of the strategic partners that we need to. The scope is quite broad for the buildings for safer air, and as you can see, there's a number of different aspects that are of interest to the community, and the aims are to provide advice regarding relevant policy change opportunities and what those barriers and enablers really are. And so the membership at the moment is quite broad. As you can see, we've had a couple of meetings already in March and in July. And I think that there's going to be support for the State of the Indoor Air Report, as Lydia mentioned. And there's also some webinars and conversation articles in progress. And so I think if this is something that is of interest to you, I think they're very open to additional membership as well. In terms of future initiatives, the focus will be trying to put together some very targeted policy briefs around indoor air quality, building standards, electrification of residences, and doing more cost-benefit analysis. I think the dollar talks, as we know. In winter, obviously, the domestic heating is quite a problem in terms of both indoor and outdoor air quality for wood heaters. And then there's obviously concerns around mold and moisture as well. In summer, focusing a lot on air purification. That's when a lot of the poor outdoor air quality, especially from bushfires, and it's occurring and impacting indoor air quality. And there's regular seminars and workshops. And so you can sign up for those membership to the centre, and you'll be advised as to when these things are happening. To move more into the biomass burning and intervention studies and the impacts that bushfire and wood heater smoke have on indoor air quality, I just thought I would put together a list of some of the research that I've been engaged with a number of members of the Centre for Safe Air, and and colleagues at CSIRO, and I think most of these have now been published, but I think there's just a growing body of evidence in the Australian context that this is an important aspect of people's exposure, and will continue to be a problem going forward as we see a changing climate and the more frequent high-intensity bushfires that we saw in 2019, 2020. And so a number of the solutions need to be identified, and I think that for me that it's been very individual based. I think it's been down to the individual to take control of their own exposures and manage their own health. And I think going forward, I think having the state of indoor air report, I think will push for some of that control mechanism to be entrained into the building design as well, which I think is important because there's only so much an individual can do for themselves. In terms of other sources of indoor air pollutants, Dr. Nigel Goodman is here today. I just wanted to sort of flag that he had done for his PhD and for other ongoing research a lot of interest. I'm sorry to be the information is covered, but he did a lot of work around volatile organic compounds in the university setting, and that's obviously today we won't go to focus necessarily on the VOCs, but I think with the state of the indoor air document, other pollutants will be of interest. I'm looking at when you hope. And so he has done some work in this space, and other activities that are currently ongoing are funded by the Nest Sustainable Communities and Waste, co-leading this with Faye Johnston. There's an air quality stream, and a lot of the focus has been around smoke and wood heater emissions, and so we've been able to leverage quite a lot of funding through Asthma Australia, HEAL, and different universities. And so there's I think when we spoke with the kids who fund the NEST program, there were concerns that they didn't have a mechanism to actually put through a wood heater change out if that was to come to light. Suddenly the government comes up with X million dollars. How would that happen? Because at the local government area, they're the ones that are responsible for managing local air quality, and they have no teeth. And so we just wanted to understand how you could go through that process of making the switch. And so that's been one of the big programs of work that's been involved. And Faye's also been asked to generate a new methodology for how wood heaters are actually tested. And so I think that's going to be an important component of new technology that's come through. So again, in economic impacts, this burden of disease, benefits of interventions, these again, get the dollars and make sure that people understand what the costs are from those exposures and the impacts on health. I'm also working with a number of different organisations, predominantly in the ACT at the moment, to look at whether there's a way that we can make public buildings safer during smoke episodes. And so we'll be conducting air quality monitoring indoors and outdoors in some of the libraries, and looking to see what are the barriers and enablers of making public buildings safer spaces during episodic pollution events. And hopefully this will provide local governments with a sort of a test survey that they can run through to identify unsuitable buildings. Going forward this winter, there will be Nigel will be leading with Satiris Sidolakis a residential intervention study with asthmatics, looking at how to reduce poor indoor air quality in homes, and to see whether that's actually beneficial for individuals with asthma. And they're looking to expand the number and location of residences if anybody's interested. Good plug. And work that I'm involved with at CSIRO, there's just started recruitment in Melbourne, and for a study that will be looking at the indoor environmental quality in apartments, and that's as a building type that is predominantly, I think, being is built in inner suburbs, inner cities, and there's very little information I think that's understood about air quality and environmental quality, energy use in those buildings. And a subset of those will be conducting particulate matter monitoring as well. So a number of different activities that are happening. I think that where I'm focusing a lot of my attention is really around mitigation and risk reduction. And I think that it would be enormously beneficial to have some sort of regulation that we can turn to and use to defend people's health. So I thank Lydia for leading the charge.
Thank you very much, Amanda. Few words, additional words about the centre. This centre is an NHMRC funded centre, as Amanda mentioned, but it is in its, if I can say this, third reincarnation. Before it was CAR, and I don't remember now what was its first name. So of course the centre, NHMRC, doesn't extend centres, but we have to apply again and then build on what was achieved within the previous term. So, and Guy Marks, Professor Guy Marks, was the director of CAR and the first, and then we were very pleased that Professor Faye Johnson agreed to continue this activity, and a number of us, we are involved in this, and we are pleased that the centre is part of this activity. The issue of bushfire smoke and wood heaters are extremely important both in the Australian context. I always remember just at the end of 2019 when bushfires were raging across the east coast of Australia, and I was giving numerous interviews to journalists, and the question was how to protect people, and I was saying, well, close up buildings, don't open windows, recirculate air. I always also remember that image of journalists reporting, I think it was in Canberra, from outside the studio, because inside the studio, fire smoke alarm went off because of the smoke outside. Well, barely 2 months passed, and the same journalists were calling me and asking what to do now, how to protect people from the pandemic, and my advice was 180 degrees opposite. Don't recirculate, open up buildings. And that the problem is that our buildings don't necessarily can do all of this.